DT the mechanic.
Case number 7.
DT is a 22-year-old mechanic looking to refill his natural tears eye drops and to also seek additional therapy for his recent acne outbreak. DT does find some relief from the eye drops immediately following the therapy. However, he finds that he needs to re-administer them every few hours. DT states that he uses the eye drops whenever his eyes feel dry at work, likely due to his hot and dry conditions at the car shop. He states that he uses 4 drops at once in each eye, which causes his eyes to overflow with tears, which he then wipes away with his unclean shirt. He does not wash his hands before instilling the drops. In addition to refilling his natural tear drops, he is also looking for acne treatment for his recent breakout.
Objective background. Eye drop container is black and full of grease. DT appears to need education on proper eye drop usage and storage. No other pertinent lab results or physical assessments. Medical history and social drug use not available. Review of system was not available. No known drug allergies. No known adverse drug reactions. No known drug intolerance. No known alerts.
DT's only current medication is the natural tears eye drops that he is using for his dry eyes. The directions of the drops are to wash your hands first, then tilt your head back, look up, and pull down the lower eyelid to make a pouch. Then place the dropper directly over the eye and squeeze out 1 drop. Do not touch the dropper to the eye or eyelid. Look down and gently close your eye for 1 to 2 minutes. If needed, wait at least 5 minutes, then place another drop into the eye. The start date of his medication is unknown. From what DT states, it is determined that he's not using his eye drops properly. Since he is instilling 4 drops at once, he is using more than the recommended dose, and he does not wait at least 5 minutes between each drop. He also stores his eye drops improperly, resulting in grease on the container of the drops. He is repeating this process every few hours, but he does not actually state how often he uses them.
Drug therapy problem 1, dry eyes. Adherence, compliance, non-adherence. DT is not compliant to the proper directions for use with his natural tears eye drops. Drug therapy problem 2, acne. Indication, needs additional drug therapy. DT needs additional drug therapy to resolve his new occurrence of acne and prevent the recurrence of acne in the future.
We came up with 2 therapeutic options for both acne and dry eyes. Our options for dry eyes are education on proper use of the natural tears eye drops, and option number 2 is to set an alarm to remind the patient to take time between drops. Our therapeutic options for acne include 2% salicylic acid face wash and Differin, otherwise known as adapalene, 0.1% gel.
Some other non-pharmacological intervention that DT can try to relieve his dry eyes and acne is to stay hydrated by drinking enough water throughout the day, avoid touching his face as oils can transfer and cause further acne irritation, change his pillowcase regularly to avoid bacterial buildup, try to avoid foods that seem to trigger acne such as greasy foods, and not wiping his face with his sleeve after administering the eye drops.
Here's DT's updated medication list. For his natural tears eye drops, he'll continue taking that medication. We want him to continue to wash his hands and make sure they're free of grease before applying the eye drops. Also to wait 5 minutes or enough time so that there isn't tear overflow after applying the product. Keep eye drops away from heat and warm areas. Store in a cool place. Do not touch the tip of the eye drop so it won't get contaminated. For acne, we're recommending 2% salicylic acid face wash. To apply, wash hands first, then wet face with warm water. Place a dime-sized amount of face wash on hand and apply to face in circular motions. Wash face for 30 to 60 seconds and then rinse off with warm water. Pat face dry with clean face towel. We're going to start this new medication. Avoid contact with eyes and mucous membranes.
In regards to following up with DT's eye drops, we'll be meeting in 14 days from our encounter in person at the pharmacy. We'll be evaluating for the effectiveness of this therapy as well as the patient's proper technique in administering the eye drops. We'll be looking for dry eye relief as well as reduction of tears rolling out of the eye after each eye drop administration. Also, we'll be looking for signs of infection in the eye, including redness and inflammation. We'll also be looking for adverse reactions to the natural eye drops, including temporary blurred vision and minor stinging.
Regarding our follow-up on acne, we're going to meet with the patient 14 days from our original meeting. This is going to be done in person at the pharmacy. In order to evaluate effectiveness, we're going to look for resolution of both whiteheads, blackheads, inflammation, and redness through visual inspection. If goal of therapy has not been met, we will discuss adding on differin, or adapalene, 0.1% gel. We will evaluate for adverse reactions and safety, such as redness, peeling, worsening acne, worsening inflammation, discomfort, and dry skin through visual inspection and verbally asking the patient.